Morning or good evening, wherever you're located today. We're really glad to welcome you to this new series of the SIINDA Academy webinars, where we provide thought leadership information and services-led sessions for those of you who are stuck with the working from home environment, but trying to keep at pace with the digital transformation and the different issues and developments that we're all experiencing. You can follow us on SIINDA Academy Facebook page, on SIINDA.org. We're also active on Instagram and LinkedIn, and we just encourage everybody to reach out to us. I'm Stephanie Verilac, or to Paul, my colleague at Paul at SIINDA. If you want to run a webinar with us, we're always happy to welcome some interesting thought leadership topics. And so we've talked a lot since the beginning of this crisis about the digital transformation pace and what SMBs can do to stay ahead and to keep track with customers and to keep out of the blue. We've had a lot of experiences from our SIINDA partners about the tools and solutions. But there's one subject we haven't alluded to yet, which is very important in the current climate. This is the links of the Covid-19 with AI and privacy issues. And now that we are entering into the change in the lockdown environment for some of the countries, there are some big questions coming in about surveillance apps, about the use of data with AI systems, and the trade-off that can be delivered or proposed between easing some of the policies and giving out some data for health management. And we're really glad today to welcome our speaker. We're going to have a kind of interactive discussion with Simon Greenman. So Simon is the co-founder and CEO of Best Practice AI. He's been active in the local search and digital industry for a bunch of years. He was formerly involved with Text Media and with European Directories. For those of you who have been around, you've probably met Simon in a bunch of SIINDA events before. But Simon is now fully committed to the AI environment, and he's also active in the World Economic Forum in the Council of Global AI Council, and he just published a paper in the World Economic Forum Global AI Council on the impact of AI with the COVID-19 crisis. So we're really glad to welcome you, Simon. Thanks for joining us. And feel free to ask any questions you want on the control panel, because we're going to try to have this session as interactive as possible. So if you have a burning question coming in, just type them in, and Paul and I will just raise the question to Simon. So yeah, I mean, as I said, we talked a little bit about the way we fight this battle without losing the privacy. And I think one of the first questions is what about the different country crisis management that you came across when doing the research? Are you seeing very big differences between countries about the way they are using policies to fight against coronavirus?
Yeah. Well, good afternoon, good morning, not sure which, but pleasure to be here. Thanks, Stephanie. Thanks, Paul. Yeah, it's very interesting. I was putting the paper together with the WEF, and I'm not a public health expert or epidemiologist, but looking very closely at how AI, data privacy, and technologies are used around the world and how it should be used. But it was interesting. I've got a few slides here, and feel free to ask questions. But looking at different sort of countries and geographies, what's going on here? And this was from Johns Hopkins University in the US yesterday. And as I said, they've confirmed a total of about 3.5 million cases around the world, with the US exceeding 1 million. But the problem with these numbers is it's all subject to testing variability. Some countries are very thorough and have a high per capita testing. Others have lower. There's also some politics involved in this as well, and transparency. Certain countries actually want to sort of boast on how good they are and raise their status. So you've got to be very careful about the numbers. But if we look at what's going on here, we can see that sort of countries seem to be at very different stages of their evolution in dealing with COVID. And, you know, over at the sort of left here, you've got countries that are just starting their growth in COVID numbers, so Russia, and then you've got others that seem to be maxing out, such as the United Kingdom here, the US, and others on the downside of the curve, such as France, sort of Germany and Spain, where they seem to have peaked and they're coming back down. And then you've got these sort of Asian countries over here, China and South Korea, that have gone through that massive spike, coming down and having a little bit of a bump back up, but really they seem to have gone through the main thing. But, you know, if we look at the numbers, unfortunately, probably the most accurate numbers to be able to compare between countries is the death rates, but we still need to treat them with some level of caution. But it's interesting to Stephanie's question of different approaches by countries to managing COVID. You can see it come out in the numbers. And so Russia earlier in the curve, unfortunately, 1,000 deaths. Sweden, an interesting country because they've decided to go for a totally different approach to most others in herd immunity and basically trust this socialist sort of Swedish nature that everybody's going to respect everyone and keep their distance, but they don't need to have lockdown. Then you look at UK here, US, and then France, Germany coming down the curve. Now, Germany sort of sticks out here in the number of deaths is about 6,500 as of last night. Then you go to Israel, which is a country of 8 million, and they've only had 219. Then you go back to Italy, which has gone through a torrid time at 27,000, and Spain at 24,000. And so you can start to see a lot of the European countries, with the outlier of sort of Germany, have had a similar sort of journey and similar sort of numbers. But if we fast forward to China, where the population is 1.4 billion, so it's sort of 20 times the UK, they allegedly, and this is the numbers they report, and again, there's politics, 4,600 deaths. But then we look at South Korea, which has tens of millions, it's 247. Singapore is reporting 14, and Taiwan and Hong Kong 6 and 4. And immediately, obviously, what we see is just a huge contrast in the mortality numbers between the Asian and the European countries here. So sort of the question is, what's been going on in terms of management by countries? And
before
this
you
isn't...
jump, sorry, Simon.
Yep.
Can I ask a question about that? In the US,
sure.
since they have so many different strategies across each state, unlike Europe, which closed borders, can we really say that the US is at the top of the curve?
Yeah, well, this is that's actually absolutely the right question, because I mean, the challenge for the US is always federal government, which is Trump, and the various states, and we know that New York State has probably top of the curve because they're starting to see their numbers come down. California's had very aggressive lockdown strategies and extending it through the end of May. So you can probably say a few states are there, but then there's some outlier states where your question is right, we don't know. Some of the more rural states. So I think that's absolutely a fair point, you know. But you know, if you would believe some of the media and some of the headlines from politicians, they are on the downside. But again, there's politics behind this. Yeah. Great question. So I summarized here, and this is not perfect, and we could spend a lot of time arguing around this, but it seemed to me when I looked at all the different approaches that really what we had, there's sort of 5 areas of which government policy and strategy around managing the crisis. And the first one is responsiveness. How quickly did countries actually get moving? Do they have a plan ready, get going? Secondly, testing. And we know a country like Germany has been very good and thorough at testing. And then there's this whole concept of sort of digital surveillance around contact tracing. So if I get the virus, can you trace all of those that I've come in contact and I might have shared it, and have can you track it digitally with my app, that sort of thing. And then you've got digital surveillance around things like quarantines. If I leave my home, if I'm in Taiwan and I leave my home and I'm in quarantine, there's going to be police finding me pretty quickly as I wander outside at this point. And then obviously we've got distancing and quarantining as well. And then there's this whole debate around masks and whether or not masks are important. And if you look at the sort of Asian countries here, and they've really gone for this sort of heavy surveillance approach, but they move very quickly. They've done a lot of testing. They're definitely surveying you, and they're enforcing distancing quarantine. They have loads of masks. You know, there's this other group of sort of European hard lockdown categories, the Spain, the Germanys, the Italys, the France, even the Greeks, where they move relatively quickly, not so much digital surveillance. And then I've got my WTF European category, which I put my home country of Britain in here. A bit slow. Unfortunately, our Prime Minister was in the midst of a divorce and also trying to keep the fact that his girlfriend was pregnant. So we were a little slow here. Testing's been fairly diabolical in the UK, so contact tracing non-existent. We have had a lockdown, but not as enforced as a lot of European countries. Masks, we ordered some from China and finally got it. And then to your point, Paul, the US, it's just all over the bloody map there because it's hard. So, you know, you've got these sort of different, what it looks like, different approaches to strategies here. And then, so Taiwan is kind of interesting. And you've got to remember for a lot of these countries and Asian countries, they've been through SARS and they've been through MERS. So they've seen the impact before. And I won't go through all of this, but Taiwan, I mean, moved so quickly to actually start dealing with the crisis. So Wuhan in China, which was the center, shut down on the 23rd of January. But even before that, Taiwan had strict travel bans. It was amazing. They had a centralized epidemic command center where they actually forced manufacturing supply chains. So within basically weeks, they were producing 2.4 million masks a day, huge number of masks coming in, and they were selling them for 50 cents. And if you did price gouging, then you would have a fine of 167,000. So this country was making sure you got masks and nobody was taking advantage of it. It was interesting as well, they had things like spread of fake news about COVID, and you got a fine of $100,000. So you had this sort of surveillance authoritarian, but things seem to work there. What was interesting, post the shutdown, and I won't go through all of this, they eventually were making 10 million masks a day, which was 40% of the population. They were linking a lot of their databases between travel and healthcare, so if you came in, they could track you, that sort of thing. And then they had the enforcement of quarantines. If you left home, you would get an alert within 15 minutes, that sort of thing. And the fines were huge. So we're sending this huge message saying, you are going to stay at home. We're going to give you masks if you have to go out. And then Taiwan was kind of interesting. South Korea was interesting. And just playing the video here, they made testing very easy. So people could go into these phone booths, and in about 7 minutes, they would actually get a test. Now, what it was key here was making it sort of very easy, accessible to do.
Did the results come in immediately as well? Or were they?
No, there's a slight lag. It wasn't clear to me how long that lag was, but my sense, and I saw it in China, was about 2 to 4 hours. The results were actually come in. But, you know, they shut them up everywhere. And the key to a lot of the strategy was obviously the testing. Now, what's interesting here is and I don't know if there are any Greeks on the call, but I mean, Greece and the European Union have had an interesting relationship at times, but Greece has done an exceptional job in sort of keeping the number of fatalities low in a population of 11 million. And they were really responsive. They saw what was going on globally and had a plan in place, freed up hospital capacity, shut down schools, travel and business, and moved very, very quickly to actually get things under control. And they had very strict border controls. And by the way, we don't have that in the UK. There's no testing when you come into the UK. There's no fever checking. There's no quarantine. Whereas Greece would put border control. And if you didn't stay at home for 2 weeks, you got a €5,000 fine. And then also, to leave home, you have to text the government and get an approved code, even for something like dog walking, and €150 fine if you don't. So, you know, Greece has an interesting sort of relationship with democracy over the years, but there's definitely a sort of more stringent, some would say sort of authoritarian approach in Greece, but at the same time, the numbers are really kind of low relative to their population. So that's sort of a long-winded answer, Stephanie, to your question of what are the different countries and sort of regions doing here at the moment. I don't know if there are any questions on
that. I do have a weird.
Yeah.
I have
ahead,
a
Paul.
weird one in somewhere like Hungary, where there's sort of a more authoritarian streak. Is there a correlation between authoritarian responses versus liberal responses, shall we say?
Well, can we answer that at the end? Because that's the theme that runs through all of this. I mean, but without being sort of trite, the issue behind all of this and things that we'll worry about at the World Economic Forum is you get authoritarian governments, and there's a saying, never let a good crisis go to waste. And they increase their sort of scope and their surveillance and their powers, and even happened in the US post 9/11. And then it's very difficult to roll back. And that's, you know, that's one of the fears in Hungary, that they will use this to continue that sort of authoritarian approach. Oh yes, the Greeks also said we have very strong tracing system and a platform for monitoring all of those in quarantine. So.
And what about the case? I'm interested in Israel, you know, because the numbers are really, really low. I saw some things about, you know, the tracing being really high, and also the fines, because I think there's a question. I mean, coming from France, where you see first social distancing is a cultural issue for us, because
Yes.
we used to saying hello to everybody with kisses, one or two or three, depending on where you are, you know, from which region. So there's a cultural effect. But I think with Israel, there's been from the very beginning a very high fine if you were moving from your house without any valid reason. So does it work? Is it working, or is it really a question of different cultures?
Yeah, I mean, it's a great question. I mean, Israel, the numbers, 212 against a population of about 8 million is just tiny. But, you know, this is a country that has a very sophisticated intelligence state, a military state. And they did do, and we'll come to a bit later, they did do mandatory contact tracing. So basically, you'll be walking down, if you were in Israel and a citizen there, you might be at home or you might be outside, or you might have been outside, but at the start, and you would get a personalized text saying, "Dear Stephanie, you need to self-quarantine for the next 2 weeks because you've been in close proximity to somebody who's been confirmed with COVID-19. That's kind of creepy, but you know, you look at the numbers. And then, I mean, back to your question of cultures. Yeah, I think cultures do play a large part in that. In the French is a very sort of tactile, and that's probably one of the reasons they got hit quite early. Italy as well, very tactile culture. And I mean, Italy's been hit particularly hard because their population skews older. There's a very older population, whereas Germany, which has done better so far, skews to a sort of on average a younger population as well. And some might say, Kimberly suggested that the Germans will keep their distance more from each other as opposed to the French and the Italians. So I think you're right. Culture is a big part of this.
Yeah, and this might probably change, you know, after we go out of this crisis, if we ever completely go out, but it's probably going to change, the way you interact, at least in a business environment, with others, because the risk is still there. So, what about the if we're moving to the use of AI? So I mean, you've touched a little bit upon that with the surveillance and the tracking part, but what have you seen as the major issues, or the major, let's say, pro and cons with the use of AI in the fight of COVID-19? So Is there a lot of discussion about using AI first, and second,
Yeah,
what
it
are the
is.
results you're seeing in the use of
Yeah, in
AI?
some ways it's been a good moment for AI, and it's always a question mark of how much is really AI versus data science. But I mean, broadly, AI is being used at general level, to help even detect detect the COVID virus. Back in late December, there was a company out of Canada, Blue Dot, and what they were doing, they were healthcare specialists monitoring the social chatter around Wuhan. And they picked up on this chatter that was suggesting there was this flu, but it wasn't quite like flu. So they alerted the world based on AI, reading all of the social media. And another area we're seeing in China is diagnostics, is the hospital in Wuhan was fairly overwhelmed, but the Chinese were able to use AI to scan patients' lungs, identify that they might have coronavirus and the severity, and help to triage the doctors. And you're also seeing around the world that pharmaceutical companies are trying to come up with vaccines and therapeutics by using AI to screen these massive libraries of drug compounds. And then you've even got robots in China are getting their day used for ultraviolet cleaning, cleaning the hospital, delivery of food, and even respite with patients, engaging with patients. So there's some really good AI for good going on here. But the problem with AI, or is the downside here, is AI has this sort of capacity to do what we do as humans. It can see, it can hear, it can read and analyze. So it makes it perfect for mass surveillance. So we're also seeing in more of the Asian countries that AI used in conjunction with other technologies for surveillance. So here, as an example, is thermal screening in stations and in airport immigration. As you're coming into a station, you can see the screen there is pulling out or highlighting people that might have raised temperatures. They're doing that in the airports as well. And if you have a raised temperature, then they will force you to go into quarantine. This one here, drones, and the Chinese are very, very good at drones. They can actually fly them around and use thermal sensors to identify individuals and then send people out to basically police to get them. This was fantastic. This was a spam, when was it? 3 days ago. In my inbox, I was getting spam for an offer of a temperature measurement kit. And this uses AI. You can see it's got the bounding box to the face. It's analyzing temperatures and stuff. So, perhaps I can have this on my front door at home. But this is not the first sort of Chinese AI surveillance technology. This one here is interesting. And again, it's based on Chinese technology, but it's being trialed in the United Arab Emirates. And the policeman with the helmet, it's actually a heads-up display here, can look around and look at up to 200 people a minute. And he or she will actually see somebody with a raised temperature and fever. You look troubled, Paul.
5 meters away, they're getting quite good,
Yeah, yeah. Hong Kong, very aggressive. I mean, this is AI-ish, but basically those that in the early days of the crisis, which believe it or not was early February, they were handing out bracelets that you can see there and tracking. In Taiwan and Singapore, they're using what's electronic faces, and there's a lot of AI mobile technology here. But basically, if you're being asked to stay at home, then they use your mobile phone as sort of your tracking device. And if you go outside your home, then you will get a call. And frankly, if you don't answer, then you will actually have people come and find you. And so it's sort of that authoritarian crackdown and enforcement of basically the social distancing that's going on here. Russia's getting in on the game for facial recognition technology. And this was from the Moscow Times, that they were saying that one Muscovite who was placed on quarantine, so came through the border, Moscow airport, returning from northern Italy in February, and then the police showed up at his apartment the day after he had violated his quarantine by taking out the trash. So I think in this case, it was facial recognition in the airport. They took a scan in the central database of all people in quarantine, CCTV cameras, as he came out of his home, recognized him, police came over. Pretty scary stuff. China, Yep, helps enforce facial recognition, enforce quarantines, detect fevers, and identifying those not wearing masks in public, which is actually not a bad idea if you believe that masks are important. We don't in the UK, but a lot of research suggests they are. And the facial recognition technologies had to be updated because what was happening is having the mask here, it didn't work as well, but they've actually updated the technology during this, so it's got a 95% recognition rate. But what makes it really, for some, scary in China is the Chinese government has a central database of everyone's name, address, and face. So they can link whatever CCTV camera and say, you know, that's Stephanie in Beijing there. That's what makes it kind of scary for a lot of people.
But that's not much different from the UK, except they don't call it a central database area because you're basically the most surveilled country in the world with CCTV.
Yeah. Funny
supposedly with less nefarious purposes, but the UK could implement this in a matter of minutes if they decided to. I'm assuming.
Yeah, and that is, I mean, it comes really out of the CCTV surveillance per capita. With one of the biggest came out of really the situation with Ireland, and there was a lot of sort of challenges, the troubles going back to sort of the 60s and 70s. You're absolutely right. The UK could do this, but the question is, will they? And what does that mean? I mean, it's interesting during this crisis, they've been actually very hands-off. They haven't had fines if you leave your home. They haven't got quarantines coming through the airport. So it's been a very sort of hands-off, almost libertarian approach. But yes, you're right, absolutely. The UK government could do this. And now the question ultimately is going to be, we're all starting to, a lot of countries are starting to come out of lockdown at this point and opening up the borders, is if we successfully keep the curve low, great. But what happens if we have a second and third wave here? And if we have a second or third wave, are you and I going to want to do a lockdown again? And whether or not citizens in European countries are going to go for rolling lockdowns over the next year, 18 months before we find it? Or are we going to say, look, I really hate surveillance, but if it allows me to go outside, catch up with my family and go to work, I'm willing to forego a certain level of privacy to have back some of my liberties in terms of freedom and things like that. And that's the key question that I think Europe's about to face. And hopefully we don't have spikes, waves 2 and 3 and 4, but that's a real possibility.
Yeah, and you're absolutely right. I think it's going to be a question of trade-off. You know, what kind of trade-off are you prepared to have? As you say, if you download the app, the contact tracing app, and it allows you to go out of your place, I mean, depending when you ask the question, you're probably going to get a different answer. If you've asked the question to a French citizen 3 weeks ago at the beginning of the lockdown, you would have gotten probably a 70 or 80%. I won't allow that. And come back now, you know, after 6 weeks of lockdown and a possible other 2, and you're probably going to get a different answers. The question behind that is, of course, the question again of crossing of cross databases, of data mining, and of cyber criminality, of course.
Yeah, no, you're absolutely right, and that leads on to, you know, this whole contact tracing thing, which is basically.
Can I just ask a quick question before that, since we're on the government? Those surveillance and all of that is government developed tools.
Yes.
How many private companies are involved in that? Because we know Facebook and Google are putting together something. Australian government's come up with an app for tracing that I think you're going to mention later. But how much of these facial recognition tools and things are coming out in the commercial sector and then being repurposed, shall we say, to more, versus how much is developed strictly by the government saying we're going to just develop a facial recognition technology going forward?
Great question. I mean, the reality is somewhere like China, they have a company called SenseTime, which is just brilliant at facial recognition at scale. So the Chinese, there's a very close public-private cooperation between the government and the private sector there in terms of facial recognition. But the Chinese government is just absolutely fantastic at this. The Israeli government is fantastic at facial recognition. And then, frankly, so are the US big techs, the Googles, the Amazons, they've all got that technology. So the governments will tap into it, but the technology is in the private sector. And most interestingly, to your point, is 2 weeks ago, Google and Apple announced a relationship to do contact tracing. And obviously with Android and iOS, it's probably used by 2-3 billion. I mean, the reality is Google and Apple and Facebook, they have a surveillance infrastructure for the world. They just don't call it that. They know exactly what you're doing, the number of data points that they collect on you, where you're going, what you're doing, what you like. They have that surveillance infrastructure, but their biggest challenge is if they're seen as surveillance, obviously their reputation. But what it looks like is a very smart PR move between these two companies is they know the governments are going to ask them for this data and getting ahead and having in place. But the argument, and it's going on in France, is Google and Apple have said it's got to be opt-in. You only do contact tracing if I say so. Whereas it looks like they're in a bit of a battle with the French government. The French government saying, look, we want to pull all this data out.
Yeah.
You know, the Israelis have pulled it out anyway, and the Chinese just pull your data out anyway. So it's a really interesting sort of conflict between values, between who is really in charge. Is it governments or technologies companies?
Interesting.
Yeah, and it's bringing. I mean, you're just gonna talk in the third part about the civil liberty implications, but coming back to what you said, I mean, the privacy impact and the fact that is it going to be voluntary contact tracing or is it going to be mandatory contact tracing? This is a completely different approach.
Yeah. So most countries, and Paul mentioned it, I mean, the UK is about 2 weeks away from its voluntary app. I don't think the government was ready. You know, Singapore had its Trace Together app, which is voluntary. And I was actually listening to the minister of Singapore in charge of this last week. And he said, look, it's great. We all want voluntary, but we don't get enough people signing up. And if we don't get enough people signing up, then we can't trace effectively and quickly. So they, were saying, should we make it mandatory? Or another approach to mandatory is opt out. So everybody, it's almost like you wake up tomorrow and that functionality is on your phone for contact tracing, and you have to opt out. Yeah, that's another approach that people haven't talked about so much.
Sounds like a U2 album.
Yeah. But yeah, so I mean, the theme here is sort of South Korea, Israel, and China. They're just stucking the data out in the mobile phone. With Israel, people are like, what the hell's going on here? I'm getting a text at home. But the reality, and this comes out from South Korea, is to suppress the spread of COVID. There's some calculations done. Is on contact tracing, you need to track 70 to 90% of contacts within 1 day. That's the sort of gold standard. Now, China started doing this manually, actually, having people, and a lot of countries are trying to do it manually, phoning up, that sort of thing. But what South Korea did is they took your mobile location data, they took your credit card data, they used CCTV cameras, they had human interviewers as well, they had health data, and to your point, Stephanie, it linked all of these different databases about you to build a profile. And they've done a really good job at contact tracing, but at the same time, that's been at the expense of basically your privacy. But it's really interesting, they have this map that you can go to called coronamap.site. And this shows, you can have it on your app or walking down the street, basically whether or not infected people have been in the area within the past 12, 24, 48 hours, that sort of thing. And China and South Korea didn't have a national level lockdown. They only had targeted lockdowns in certain districts and areas, that sort of thing. So their mass surveillance has basically meant that we weren't all at home. They weren't all at home. The healthcare system's working. And the economy kept on going. But it came obviously at the expense of privacy.
Yeah, and it can only work if you have a proper testing system in place.
Yeah.
Because otherwise you're not able to actually know if you're infected. And so I think this really goes, like you explained at the beginning, it's because they've been really fast in all the parts, not only the mass surveillance, but the testing and the mask approach. So yeah.
Yeah.
But
yeah, I mean,
as you
and
said,
so
yeah.
sorry. Carry on.
No, go ahead. I was just going to say it's really a trade-off, right? Freedom of
Yeah.
movement versus surveillance.
Yeah. So South Korea, absolutely right. So South Korea, you could see on the left here year-over-year comparison of how much restriction on movement. So 17% down in retail, 13% decrease in workplace, whereas somewhere like Spain was 94% down in retail and 68%. So to your point, trade-off of mobility and movement versus privacy here. Another trade-off is, and this is really interesting, Juan, coming back to life, is whether or not we would be interested, and you can't hear the sound here, but hopefully you can get the gist of whether or not we would be willing in Europe to have immunity passports, which is basically if we have immunity, could we have an app that says we've got a sort of green immunity and we would be allowed into buildings, into residential complexes, events and things by virtue of that. And that's what they've done in China is WeChat and Alipay, which is about 1 billion people use their applications a month. You'll have a code, green, amber, red, as to whether or not you have healthcare. So this video here is just showing people lining up to get their tests. Bit chaotic because, but then you have your test taken.
But this has completely different implications in the US, where insurance companies and the level of data and how much they're going to charge and pricing and all of those sort of things versus a European model. So
yeah, absolutely right.
Another thing.
And this video here shows, of your QR code to get on the bus. We've got queuing, obviously, in shops and things. Entering or leaving residential block. Going into shop, got obviously distancing, but please show me your health code. And some shopping centers. It's interesting on the shopping center, they've also got body temperatures as well. So, but the issue with this, it's multifaceted. I mean, great for those people who get the immunity check and it's green, but there's also a lot of cases in China where people's code are coming up red and there's no recourse. They don't know why it's red. There's those that are sort of the digital assumes a digital leap with phones, but there are still a lot of people that don't have it. So, but it's a real sort of, Stephanie's point, a trade-off question here of whether or not we're willing to trade off some level of privacy for freedom for other civil liberties.
And do you think that's going to be a question of age groups, and digitally savvy people? Because I just thinking out of loud, seeing all that, it might be something. We all have a phone, and if we agree to have the immunity passport on your phone and stuff like that, but what about my grandmother who is 90 years old and she just wants to go to the grocery, around the corner? She's not gonna come up with her phone and a QR code and stuff like that. It's just,
absolutely right, and that's the challenge of this. That's the challenge. But there again, how are we going to do? I mean, our vulnerable group's going to be forced to stay at home. So the elderly or those who are sick and things. But in the UK. My sister-in-law has a condition, she's a very manageable condition, but she received a letter from the health authority saying that she needs to lock down for 3 months. And probably the elderly, my parents in Scotland, will probably have that letter as well. So we are probably going to get into this situation where we have different segments locked down for different periods. And how do you enforce it? Yeah. So this is
Thank you.
sort of the last stuff. How are we doing on time? We've got about 5 minutes. So,
Yeah.
But yeah, I like this little slide here. It's the theme that you've picked up on and talked about is really what are the hard choices and the trade-offs that we need to make as society here. And this is from Tony Blair's former British Prime Minister's think tank. And he basically said, generally, countries can only avoid two of the following. So you can avoid your health system being overwhelmed and your economy shut down, but you can't avoid increased surveillance. So if we really wanted to have both our health system and economy up and running, then we would probably have to increase surveillance. Now that's the debate fundamentally. And so policymakers, I mean, they've had a really hard time here, but they've generally made in Europe and somewhat in the US that we're going to make sure the health system isn't overwhelmed, but the consequence of that is going to be the economic shutdown. And that's the trade-off that we're willing to make. The Asian countries have said we're more comfortable with surveillance, so we will keep the health system running and the economy better working. So, and then just finally, some of the attitudes, and you touched on it earlier, Stephanie, which is citizens are going to start getting tired, fatigued about this, but there are some very clear attitudes towards surveillance technologies. And in this case, it's a survey about facial recognition. And broadly, if you look at up the top there, the benefits is China in red. Generally, they find facial recognition technologies helps on convenience, it's efficient, you know, because you use your face as identification when you go into a bank and stuff like that. They're generally more comfortable with it in China. And also China, Europe, and US are more comfortable with facial recognition technology for security. But where there's a big difference is in Europe, we see big risks in facial recognition technology, particularly Germany in the orange there, very uncomfortable with facial recognition because it would violate our privacies. And in particular, Germans are very, very nervous about facial recognition technologies used for surveillance, as is the rest of Europe and the US as well here. So there's a nervousness around it, but at the same time, back to your point, I think we're getting a bit tired here. We've been locked down here, and we've been out of jobs. Public support, you said, was what? It's dropped below 50%. In America, you got these anti-lockdown process. So the question is really, what's going to happen next? And you know, we're seeing European countries coming out of lockdown. Those in red are starting to ease their measures. So France, Spain, Czech, Austria, Norway. Some relaxation in Germany, and in UK, we have no idea when we're coming out of the lockdown at this point. But you know, so overall, you know, the good news is it looks like we're on the downslide of the curve, but really the key we need to look out for is if there's further waves here, or should there be another pandemic in a few years' time, will those trade-offs between health, economy, and surveillance, will European and US reevaluate that balance? And will citizens be willing to have greater surveillance if it meant that the economy and the healthcare system work better in these situations? And that's sort of the fundamental question that I think governments and society are going to be wrestling with in the now and for the coming years. So that's all my formal stuff. I don't know what question, if we have time for questions here.
I had a quick one on just on the last slides about the gathering of the data. So assuming that in Europe that we accept that for this crisis we're going to allow ourselves to be tracked and traced and things like that. That data is going to be stored, and it's the repurposing of that data. And AI relies on a huge amount of data to improve. So at this time, they're gathering data for let's call it a righteous purpose, and they're going to gather that. What is to stop legislation being put in place to delete that data after a period of time and not feed it into other learning systems for other purposes?
Yeah, absolutely. that's absolutely the right question, and that's a lot of what we're looking at the WEF is, let's say we do see some of our privacy for this, how can we trust our governments with it? And there won't be scope creep and continuation. So the paper I wrote last week was all about, we need to trust our government, and that will come with basically there's a time limit to the use of this data, i.e. and maybe we even delete the data. Governments need to be transparent about the use limit. So the data will only be used for this particular use case and not for others that could come out of this. It's got to be fair and inclusive as much as possible as well. So, for all citizens, it's clear that sort of in the US, it looks like ethnic groups are getting hit much harder with mortality rates. Transparency, we want our government to actually tell us, and that's actually been part of the South Korean approach, is basically saying, look, we have an authoritarian approach, but we're going to tell you how we use the data and what we're doing with it. So let's open up. Accountability as well. Can we have, sort of parliamentary oversight into this, but also an independent sort of group? And you see this in big tech companies. They will have independent sort of ethics councils for the use of technology. So accountability and oversight. Now, so if we could get this sort of architecture of governance, then I think that will give us more assurance as citizens. But obviously the question is if. But fundamentally, we believe that AI technology and data privacy is something that can be used effectively in difficult situations, but it needs to be done within this architecture.
Yeah, and you're right. I mean, there are some legal boundaries already in place. In the EU, you have the GDPR and the data retention directive already, putting in place some boundaries about how long you can keep the data and so on. The big question is going to be the cross interference between public and private databases, as we spoke about, and also the cybersecurity threats. Because nobody would like to have all this health data available on the dark web for any kind of unlawful transactions. So, and I guess there's going to be a lot of questions to put in place by governments to make sure that security is also at a very high level before it's rolled out at scale. So an interesting topic maybe to talk about for the next one. Cybersecurity. Approaches on systems with the crisis management.
Yeah, a lot of things there.
Yeah, well, I don't see any questions coming in. Yeah, you see one. Let me see. No,
I lost my control panel somewhere, so I can't see.
I see one from Kimberly. Do you think that this may change some of the data protection regulations?
Yeah, I mean, it goes to your GDPR thing in Europe. I mean, the GDPR regulators have said things like contact tracing apps should be opt-in, which is sort of follows the philosophy of GDPR, which is consent comes from individual and individual. At the same time, there is provisions within GDPR that national health crisis, you can mandate data. And that's really going to be the tension. Is the European government's going to pass legislation to mandate healthcare data? And I think the answer is they won't unless there's more waves of this or if there's another big pandemic, because the pain of going through these lockdowns and economic versus what's gone on in Asia, I think we're going to have that conversation as a society.
Definitely. Okay. Well, thank you very much, Simon. I think it's been a fascinating discussion, and we could certainly hold it for another 2 hours or so. But yeah, thanks a lot. I just encourage everybody to look at your and we're going to repost your paper on the SIINDA website, right? The one that you just did for the World Economic Council, so everybody can look at that. And the recording is the webinar, sorry, is recorded. So anybody who missed it, you're going to get the recording link. And that being said, well, thanks very much for your time today, and everybody stay safe and healthy.
Stay safe, healthy.
And see you next time for the next SIINDA webinar. Bye-bye, everybody.
Thanks. Bye-bye. Well, we're still here. We're trying to figure out how to leave the meeting. Lost my control panel.